Kalispera. Hello. Thank you for joining us for this session on bioethics and digital mental health. Can chatbots and telehealth safely improve access to care? I'm Jeremy Sugarman. I'm a professor of bioethics and medicine at the Johns Hopkins Berman Institute of Bioethics. I'm joined with Effie Villena. She's a professor of bioethics at the Swiss Federal Institute of Technology Zurich, better known as ETH. And Dr. Fred Munch, clinical psychologist, senior advisor, and former president and CEO of the Partnership to End Addiction. Before we get going, please take out your apps. If you haven't done so already, open up the app and you'll see in this session a set of polls. There are 3 questions we'd like you to answer so we can assess what's going on. So please, if you haven't done so already, take a minute to do that and we'll be with you in just a minute. I know some people are still answering their polls. But we're going to see what's going on with the results of the first question. So the first question was, how familiar are you with the availability and use of digital mental health services? About 28% very familiar, 26% neutral, 28% not very familiar, and not familiar at all. Well, you're in the right place. Now notice the little bit of difficulty you had using your phone at the beginning? That's a transition. But now you want to get care for mental health problems. Is that going to work? It might. It might be really useful. Let's go to the second question. Would you trust using artificial intelligence to give you a mental health diagnosis? 26% yes, 74% no. And the next one, would you trust using artificial intelligence for your mental health treatment? 26% yes, 74% no. We've got some things to talk about. We just heard Selena give us a great talk with the hope of technology. She told you technology is part of mental health care today. Let's turn first to Fred to think about what really is being done now in terms of these virtual or digital methods of providing mental health care.
Thanks, Jeremy. Thanks, everyone, for coming out. I think, we tend to go, when we think about technology and mental health, we tend to go, is it an app? Is it a wearable? Is it a VR headset? Is it a bot, interactive? And if we think of what's out there, it's almost unlimited in terms of what we can do, but clearly we're not accessing it. And part of that is because it's not in our lives. And so when we think about our technology, it's in our lives in terms of mental health. It's in our lives in other ways. So when we think about mental health, we want to think about what's the goal, what is the technology that we're going to use, and what's the underlying algorithm. And then you can sort of dive in to think about it. So if we think about mental health, we think about engagement, we think about assessing and diagnosing, we think about supporting and connecting people. And in terms of engagement, when we think of technology, we want to go ubiquitous. So the ubiquitous apps that are out there are SMS, WhatsApp, Facebook Messenger. All of these tools are accessible to more people in the world than anything else. They're accessible in remote populations. You don't need a smartphone except for some of the WhatsApp. But SMS is available to everyone. You can add a bot into SMS, so you can create a whole program. That's the underlying algorithm or technology. And if you want a closed group, you can do something else. In terms of assessment, there are tons of things. Right now, Meta, Facebook, is assessing everything you're doing, right? So in terms of these algorithms, they're assessing everything. We did a study called the Digital Marshmallow Test in assessment, and we used the marketing literature to create our hypotheses, and we found that the more someone touches their screen, the more likely they're to engage in sensation seeking and impulsivity, and it was better than the most reliable psychiatric measures of sensation seeking. So it's all there. We're assessing our everyday. So there's apps that can assess your vocal prosody, your steps, all of this which are directly related to mental health. And then in terms of support, well, when we think of support, there's so many ways we'll want to be supported, and that can be through chat, that can be through a bot, that can be through telehealth. And typically the way I like to think about it, so if we're creating a framework, is to think about the underlying mechanisms of support. So is it synchronous or asynchronous? Right now I have a quick question, and is it automated or is it human? How many people filled out the survey because of the push notification? That you got a push notification in your app and then you filled out the survey? Okay. How many filled it out because of Jeremy, who's saying it? Okay. So what we see is right now, in terms of this audience, what you're doing is you're filling it out because you trust him, he asked you to do it. But some people filled it out because of the bot, right? Because there was a push notification. So how do we use them together? It's called supportive accountability. Is something episodic? Is it continuous? Do we want to keep it? Is it an immersive experience like a VR headset, which are available, but they're expensive? So we want to understand what's our goal, who we're pushing it out to. And then with regard to mental health, the last thing I'll say is when we think about technology and mental health support is we really want to understand anonymity versus something being identifiable. And people disclose way more to digital systems than they disclose to humans. So it opens the door to the conversation. I actually think the reduction in stigma around mental health is due to the mechanism of people reporting and feeling more comfortable reporting to digital systems, and then that created a feedback loop to reduce stigma. So understanding the goals of what we're doing is incredibly important.
So great. So Fred outlined a few different kinds of tools and different modalities that could be used to provide mental health services. But Effie, what are the ethical issues this might raise?
Thank you, Jeremy. There are many different approaches we have in digital mental health, and I think actually all those do raise ethical questions, and they raise different kinds of questions. So is it a push notification that you're getting in an SMS? Is it a chatbot you're interacting with? Is it a telemedicine/digital health version of your treatment? All of those would raise different types of ethical questions, but I think all of them raise just there's some that they have in common across the board. And I think the first one is the question of whether these technologies, whatever they are, whether they're safe and whether they're effective. That's something that in health and in medicine, we look out for in whatever intervention you're making, whether that's diagnostic, for example, is it an accurate diagnosis, or if it's treatment, are we sure that this treatment is safe and effective for people? And I think here, Fred, maybe I'm not sure that we have the full picture with all of these different kinds of technologies that we put out for people to have access to. So that's one big across the board, and of course, different types of technologies would vary in degree in terms of how safe or effective they are, and I think we can talk about it later more. The other big question is the question of privacy and confidentiality. And you did mention that actually people are more willing to share when they don't have somebody in front of them and they have to talk about how they feel or what they suffer from. And we're seeing that in studies, which is promising in some ways. On the other hand, and we also see that people, of course, engage with digital technologies, with apps of all kinds. We've been talking about the privacy paradox, that people put all their information somewhere and at the same time they're worried about their privacy. But I think when it comes to health in general and mental health in particular, how safe the informational privacy of people is going to be, it's very, very important. Whether people themselves care about that or not. And again, we have a whole range of ways to go about it, but we do also have a few studies that show that digital mental health apps in particular, not all kinds of technologies, have been actually not very strong in protecting people's privacy. And so I worry about that particular issue. On the one hand, you don't have somebody that you, across from you, another human, so you feel more comfortable. On the other hand, that doesn't mean that you don't care about your privacy. So that's the bucket I think we have to be very careful with. And the third big ethical question for me is who has access to these technologies? Again, because they can scale so quickly and globally, the potential for increasing access is huge. But in that potential, we shouldn't forget the digital divide, the fact that not everybody has the same kind of savviness when it comes to digital or access to digital technologies as we maybe in certain rooms think that people have. So 3 big buckets, but we can get to more.
All right, great. So Effie wants to know, does it work? Will it hurt you somewhere in terms of privacy, and can people get it? Those are really crucial questions. And so Fred, Selena outlined at the beginning, there's a huge need for mental health services. Not everybody can access a therapist, not everyone can access the kind of care they need. There are different situations around the globe where access is desperately needed. What do you think? Is it possible to scale these things, as Effie mentioned? And if so, how, and what would that look like?
Yeah, so I think in terms of access, there's not really a race, quite frankly, in terms of we need technology to help people access care. Earlier we heard 30% of people referred to mental health treatment go to treatment. We have a mental health crisis, and yes, we need to train community members, but we also need to know the vulnerable state that people are in when they seek care or when they're trying to think about care. And so in terms of access, the easiest way is to think of what is the most common communication mechanisms that people use and then use them. Right now, technology is the world's outreach worker. It is the one thing. When I was an outreach worker, I would hand out condoms where young people, sex workers, were working. I didn't go anywhere. I didn't wait for them to come to me. So I think in terms of access, we should start there. But if we end there and think that technology is going to be the thing that connects people and they don't need connection, that's where we're making a lot of our mistakes, which is to think technology is a panacea. It's just a tool in our toolbox. And I also think, I do want to mention one thing about the literature on efficacy of technology-based mental health interventions is quite strong. And the literature also comparing it to in-person interventions is quite strong. We just finished a study where we found we can reduce drinking by half with an interactive text messaging intervention for people who want to reduce their drinking, which is almost as good as in person. So what we're seeing is this growth in this literature. And one of the things we found there was that people actually said, I got connected to meetings in my neighborhood because you gave me all those resources I need. So it wasn't really the text messages, it was just a medium to get, and a means to get to the end.
So Effie, what do you think of all this? She gave you some efficacy data. He's coming
yeah.
back to you. He's doing a Serena Williams, right? So back across the court.
I love it. I think, the more of this, we've been calling for these kind of studies to be out there. And anytime we see one, we're very, very happy because by we, I mean, I guess everybody. We want something that works. And we're in a space, mental health apps in particular. I mean, there are different things we're talking about here, but we know that digital health apps, they operate in a kind of interesting space. They're not medical devices, the things we really scrutinize before we put in the market. They're not things that you just, buy at the supermarket and nobody checks on, or you don't check so much on. They're somewhere you think they might be doing something. They're in the wellness, health kind of spectrum. So I think many of those have been missing that important part of efficacy. And so I'm very happy that we have it, and I'd love to see more. And since we are at that one, I think the safety part is also important for me. Now, those of us working in the sort of digital health space, they've been talking of these 2 types of safety. Physical safety, does the app work to make you better, to have an impact? The other is the informational safety. Is your privacy protected? And I think there it would be great if we're seeing more evidence. So not separate the 2 as 2 different things. The data protection people worry about this and the medics work about that. We have to be worried about both all the time. And not worried in the sense like I'm anxious, but in the sense that this is the kind of information, this is the kind of evidence we want to collect and we want to put out there to people in a way they understand it, so we don't have the answers to the other questions. It's like, no, I'm not going to use it because I don't know what's going on. So I'm very happy to see more efficacy.
And in terms of privacy, yeah, we're screwed. Just really, no, really, it's not good.
Not yet, not
yeah,
yet,
yeah,
not yet.
yeah. Just right now, we need more regulation. There's not enough regulation. We know that people are sharing data, even companies are sharing data to get more ad revenue, to figure it out. There's a lot of work that needs to be done.
Okay. You said you were worried. I was about to see if I could get an app for you.
Yeah, but I did qualify that. I said I'm not anxious, right?
Oh,
Just a
oh,
little
yes.
bit. I was still in the sort of like
Well,
space that
that's
it's okay. No app yet.
All right, great. Well, we want to hear from some of you and what your questions might be. So we can start we have our youth ambassador here who's going to start off with a question. Should we? Okay, we'll take him from here then. So there was a hand that went up over here. We're going to need the microphone over.
There's one.
And there was another one on.
And the back.
In the back, okay.
And in the front.
So we'll start
Great.
here. Oh, hey. Okay. Hang on. So she's bringing a mic. So after she's going to start, then we'll go to you, and then we'll go over there.
Just a reminder that you can also send your questions through our app, but I'll take the chance to ask the first question myself. So today's conversations are more and more automatic and less human, which is actually one of the reasons people start feeling lonely and seeking psychological intervention. So my question here is, how can we manage to take this like technological measures as an opportunity for connection rather than another form of disconnection with humanity?
Okay, great question. And so I'm going to give you an example from my personal practice. I also work as a physician. And I know that people that come to see me, almost every one of them has consulted someone else before they come see me, Dr. Google, right? So it's impossible to practice medicine today, and including healthcare, without knowing that someone has a frame of what they've learned from Dr. Google. Sometimes you're relieved. More likely than that, you realize that tiny little dot on your hand is cancer, and you're worried about it. Your headache's a brain tumor. The worst things happen by the time you come in, and so you're positioned in some way. What you can do in that situation is recognize that people are using technologies to differing degrees depending on their age group, their familiarity, their comfort with those levels, and then ask them what they think they already have and what resources they've already tapped, so you can actually build a connection faster rather than something to be fought away. So that's one way to make the connection even more human. So starting technically and going back to the old-fashioned way. Do either of you want to come in on that?
Yeah, quickly to say that, that's a very serious question, I think, and a serious concern. Again, I'm not anxious, just concerned. And one way to do that is to design technology being mindful of that risk. I mean, it's very important to think, how do we design a good piece of technology? Is that one of our considerations, or is it just the technology is flashy, it's fantastic, it looks great? Could it have that kind of effect on people? And the other, I think, way to kind of safeguard that a bit is the extent to which those kinds of technologies are integrated into our broader concepts and institutions of healthcare. Are they just out there for people and nobody is helping them out to navigate them? Or are they, integrated into how do we approach mental health systemically?
Great. And there was also, the recent reports of ChatGPT and other forms of technologies making more empathic statements than physicians. I mean, it's a little humbling after all those years of practicing medicine that you can type something in that makes a better statement. But in fact, those studies are coming out. So there are ways of building that humanity. Why don't we go, there was a question over here, and then we have, the mic's already distributed, so I'm going to try as fast as I can. So we're going to go there, and then there, and then there.
Thank you very much. I would like to ask Dr. Vallena, she talked about privacy and the protection of data and who has access to data. I would like to ask you about what do you think about the ownership of the data? Who should have the ownership? And Dr. Munt, you talked about extra regulation. Healthcare is already an over-regulated environment, and for this reason is a very slow adopter of innovation. So when you talk about more regulation, what kind of a regulation?
Okay, two great questions. And
we need a whole session to answer, especially the one about ownership. That's a very complex issue. I think the way we try to treat that difficult question is by not necessarily using the concepts of ownership, but rather the concepts of control. So you control the data that you are that are collected on the app, that somebody has access to, like the company that is running the app or whatever system is that you are using, but you control how they're going to be used. And I think that's an easier way to go around the problem, that you have to have control of how your data are going to be used by them, with whom that company who has access is going to share, and with whom maybe shouldn't share. A longer answer I have for later, though.
I completely agree that give the control entirely to the end user, to the patient, and regulations need to be set in place so applications have to do that, and they're not allowed to sell that data. I think that's crucial, and it's not a long, terms and conditions, but that it's very, very clear. And, I also think that our system of mental health is broken now. It's not where it needs to be. We're not reaching people. We had from, Freud to ChatGPT. Some people still believe in Freud's theory, and it's been disproven. There's no evidence for it. It's philosophy. So how we think about this in terms of how we're moving forward to develop regulations around empirically supported treatments in terms of what's going out there, and offering people the control of their data, not only what they're doing, but how they want to be treated, I think is important.
Okay, great. So just a matter of organization. First, Fred, philosophy is the queen of the sciences. We're with us. You're hurting us. But what I would just say, if you could please go to your app again and answer those questions while we go forward. And in the interest of increasing access to people who can't be in the room, Camilla's got the ability to look and see what's being generated for the people who are joining us online. So she's going to take over because she's got the cool tool and I don't. And so she'll answer some questions and then we'll come back.
Okay. Okay, thank you. One of the questions we have on the app is, how can we establish therapeutic relationship if people are trained not to share with humans?
That's for the doctor.
Yeah, Fred.
So how can we, I'm sorry, how? Okay, so we did another study where we looked at the Therapeutic Alliance scale with humans and digital, and other people have done this study at Stanford, across the board. And people develop relationships with artificial intelligence. They develop the movie Her, right? They develop relationships. And the Therapeutic Alliance with systems is just as high as with humans. Now, that's not saying that one can replace the other. It's just that if we think of an integrated model with both, we shouldn't discount. Jeremy mentioned a huge study where they looked at empathy from a physician versus empathy from AI. It wasn't even a race. If you look at that data, if that was a drug, it would be $1 billion company overnight. So just being mindful of, we can establish therapeutic relationships. The key is make sure we trust the system, and that we don't fall into the trap, as everyone's saying, that this is the end. It's a means to an end, a means to connection.
Great.
Okay, so I have another question here that says, in Greece, but I'd like to take it like worldwide to many other places, but in Greece, it is already a privilege to have access to mental health care. Oh, I'm sorry, the app just closed. I'm sorry, a second, please. So I think we can take another question from the audience while it loads. I don't know, I've been logged out.
There's a mic in here, so go ahead.
Hi, thank you very much. I'm a child and adolescent psychiatrist. I'm wondering how we can empower individuals to critically assess the safety, efficacy, and privacy issues related to using technology.
Great. So Fred, why don't you take that, given your work in
Sure.
this area?
There are app rating systems, and for mental health, for example, Stephen Schuler out of UC Davis, I believe, no, or Irvine, has a rating system that they've developed. There's others called Mind Tools as well, which I've helped consult with, which is both looking at the safety and whether it's using an empirically supported treatment, but also whether it's engaging to the user and how often people stay with the system. So they're out there, there's more of them. Also being careful that, you know, the first one that started closed because it didn't disclose all of the privacy concerns. So one of the things we're in our infancy. We think it's ubiquitous and it's around, but we're really just getting started. So, but I do recommend going to these different sites online. Yep.
I think we can take another question from the audience, please, if anyone else has one.
Yes, thank you very much. Over here. So, my concern is about the word safety. Are we considering that safety against humans, or we are talking about the level that we need to be concerned about the safety regards AI? Because now, like Dr. Freud said, data-wise, we are screwed. Like every company have our data. We should not be concerned about that, but we should be concerned about the use of it, what they can do with it.
Okay, I'm going to say that I don't feel that we're doomed. I'm not so fatalistic. And I don't think that we should not continue caring about things. We can undo things that we don't like the way they were done. I think that has happened many times in the past. So I still feel that we have ways to protect our privacy and to protect our data. It's going to be different ways than the ones we knew before. So if you're with me, we're still having ways and we still have to care about it. I think in terms of safety, so that takes care of the privacy question, but I think in terms of safety, what at least I meant is that if we put out a technology that we think it's going to have a certain effect on people, that it's going to have that effect on people and not something else that we don't want to be there. So, the undesirable effect that it leads people to the outcome that we told them are going to reach when we propose the tool, which I'm borrowing from the same thing that we're doing in the rest of healthcare and medicine. And so the question I guess we're asking is, are we comparing this with how well a treatment that a human is offering is going to be? And with humans, we do have a range of outcomes that we have, but we consider them safe in terms of fixed sort of treatments or approaches. So that's how I would think about safety, but maybe Fred thinks, I don't know if you think in a different way about that.
Same way. It's the same as you would approach a therapist. I've been to many therapists in my life. Some are good, some are bad. Same thing in terms of with apps and doing this.
So great. So if you could just finish answering that poll one more time. We just want to make sure we get as many responses as we can.
I think we have time for this question. I started reading before. I'm sorry for that. So the question says, in Greece, it is already a privilege to have access to mental health care. If we create AI tools that vulnerable and underprivileged groups cannot access, are not we just creating another barrier to healthcare, to mental health care?
Yeah, I guess that's again a really important topic and question, and this has to do, at least in my view, with what we understand as access to digital. We do tend to think, perhaps everybody in this room, because we're on our phones, that everybody's online and everybody knows how to use technology and everybody is comfortable with using technology or can pay for a variety of apps or services or data or subscriptions. And I think that's something that hopefully it will be what's happening. But in many countries, and I think including in Greece as well, we cannot say with certainty that this is the case, that everybody has this kind of technology. So again, when we're designing tools, number one, but also when we're deploying tools, I think this is an important consideration. How do we address everybody, including those we know statistically from our statistics that they do not have this kind of access to digital technologies?
All right, great. Well, that sort of wraps up our question and answer
Yeah,
section.
that's all for the questions.
We're good?
Thank you.
Excellent. So let's pull up the results of that poll and see how people are thinking. Let's pull up the poll. Oh, here we go. Okay. So the question again, the question should have looked familiar. Would you trust using artificial intelligence to give you a mental health diagnosis? 60% no at now, but 71% at the beginning. So a change of about 10% of people are actually more willing to use AI to get a mental health diagnosis. Let's see what
Jeremy,
happens.
can I jump in quick? Just one quick side, if that's okay.
Just don't jump off the stage.
Yeah. I actually didn't give my pitch for diagnosis. I didn't even talk enough about it. It is better for diagnosis. I just want to throw it out there. The whole goal of technology is pattern recognition. And if we look at the opportunity to merge subjective and objective data together to build patterns to understand mental health diagnoses, this is where technology thrives. It doesn't do as well with treatment, quite frankly. And the other is, I think like radiology, where it's technology-based diagnosis and then you have someone confirm or deny it and do a little more, I think that's where we'll end up being. But it's the one thing I'm evangelical about, and I probably should have said this before.
All right, let's go to the next question. And would you trust AI for your mental health treatment? At the beginning, 74% were no, and now it's only 60% no. So you're still seeing similar patterns, but changes in the magnitude, which is kind of interesting. Well, like every good therapist says, our session's up. So, because we couldn't answer all the questions, what we decided to do was ask ChatGPT the question of this panel. And we're going to type that in now. And let's see what ChatGPT says. And I'm going to give you a little warning. There's a lot of it. You're left to read it on your own. Thank you very much.
Thank you.